Gauteng Health MEC Bandile Masuku says the province overtook the Western Cape's confirmed cases. He says initial projections indicated that Gauteng would be the first province to reach a high level of infection in the country, but level 4 and 5 of the lockdown helped reduce and keep the numbers down for a while. The Provincial Command Council gave an update on its response to the pandemic a short while ago.
We are actually taking over from Western Cape. The initial modelling that was done actually indicated that Gauteng was going to be the first one that will get to this number of confirmed and active cases, or become the first epicenter of the pandemic in South Africa. But I think the lockdown, level 5 and level 4, helped us in a great deal to reduce the rate. But now, because of our urban nature of the province, and also because of the highly populated province, 1 in 4 South African actually stays in Gauteng, and we've got a high number of informal settlements which are actually densely populated. So this number is actually expected, as we have said before, that being an epicenter of the pandemic is actually something that we were expecting, and we were just preparing for us to be able to deal with the storm. So as we said last week, that the storm is here, and now we have to play a part to weather the storm and make sure that we're able to deal with the storm as it goes.
Masuku says his department has made provisions of fever tents at hospitals as space is running out due to an increase in COVID-19 infections. He says this is to ensure that no one is turned away.
This is just a demonstration of the current bed availability. We have been indicating this number. The number continuously increases every week as we put up the refurbished wards, as we open them up. We have done the same in Charlotte Maxeke. We have done the same at George Mokare. We have done the same in Kopanong, and we are going to continue doing the same in the coming months, in the coming weeks and days, to make sure that we are able to fill up the gap in terms of the bed analysis. The other important aspect about this, which I need to report on, is our bed management team, which combines us as a public sector, the Department of Health, with a lot of the majority of the hospital groups, where we're able to direct and also get us to be able to direct patients' flow and be able to see where beds are available. This is an important way on making sure that we calm down the panic and also calm down the desperation of beds. And when the EMS or anybody picks up a patient, should be knowing where the bed space is available, and they will be able to take up the patients there. We have also put up fever tents in most of our facilities, which will help us that the patients that are arriving in hospitals are not turned away. They actually get a place where they can receive treatment in the meantime whilst they are waiting for a formal bed, even if it's outside the public sector, and also referred to a private sector.